Although health experts continue to caution all Ghanaians to strictly adhere to the COVID-19 safety protocols following an increase in cases in recent months, there are many on the streets of Kumasi who still do not believe in the existence of the virus.
I think the virus is not there because we don't record the cases, and I think they've stopped checking it, so it's not there.
Yeah, pescan ya dia below. Yeah, Maxi asem. Yeah, well, may mu had ye who saw my bay ye. A walk room hako. Yam, my penny for na. Yantim may mu on bay ye. Said you a ye, Kofo a ye, bla, a ye, Nino my baba ye coin, no man, yet me main for no. And no dear him on Mama Baba and the Master Hona, they say no more journey. Ah, they say, yeah, pay ya near blue. And to your bay, I found when I am found, they say, Yabre.
In the Ashanti region, the Kumasi South Hospital and Comfort Anochi Teaching Hospitals are the two main COVID-19 treatment centers. As the Ashanti Regional Health Directorate says, many cases are being recorded in the region and the number of COVID-19 related deaths have skyrocketed during the third wave. I have come to the Kumasi South Hospital to see how the facility has been faring. Here at the treatment center, Mame Akosia is receiving treatment after days of admission due to COVID-19, and she is not alone. She is here with her 18-month-old son, whose situation is quite severe.
Me buy no, you call case ward. The severe pneumonia in a buy. I dare na almost screening for COVID because na ne all show no extra COVID. Nti almost screening no who say COVID and omu ye ba.
Na omu kacha mu say COVID no mo fa na say so no be nyina wetimenya COVID.
Okay, starting de na eye me wan kakra. Me momu de anka enha me be me ba no. Say ya onu betimi anya COVID because no onko ba bia. Me de me pie, but no onko ba bia. Nti starting de ma mfa na easy. Na me sure.
Mama kacha ka ujidi se ampa obanno ne wo COVID na se okra na unjindi.
Omo kacha me de me gidiye. Be na me hu baby cry free. Nti me ma omo nso teste me. Be omo teste me na me so me ye positive. Na me hu se ebetimi aba se me mom na me de ama me ba no. Efise me ne da.
Na so far the treatment no ho ne say.
Okay, compared to previous days in a day. And then who ye by now the oxygen so na udi ni jina hokra ontimu njina waye mrankasa be and then me who say improvement aba.
According to her, although she has been vaccinated, she still contracted the virus, albeit with mild symptoms. She is thus urging the public to adhere to the protocols.
Me ankasa de because am awo injection intino. Minya akata cold. Be mini difficult in breathing.
But also wa vaccine no.
Ai, ma take it two ni nyina. Enti minya symptoms ne de be me na ho ne signs and symptoms ne ba starting ukra unji ni. Be obu ha ni immune system na ti mu fight against like me myself. Ebi asema wo injection na minim de na nka. Compared to me ba ne de, it means say obi a ne na ho odin. Oh, wa ubetimi anya. Ubetimi anya. Wa wo be ubetimi show signs and symptoms. Ubetimi dey assign obi a onwo ye. Ama say nipa na yare kra mo. Na wo no nso ubetimi anya. Sema wo nso menya.
Health authorities in the Ashanti region say that until June 2020, COVID-19 treatment centers were virtually empty, as there were less than 20 cases per week throughout the region. However, the number of infections shot up astronomically following the blatant disregard to the protocols. Treatment centers began to feel the pressure, and the Ghana Health Service resorted to creating other peripheral health facilities and using private hospitals to support in treating COVID-19 cases in the region. Here at the Kumasi South Hospital, the health workers say they have now been recording more cases and they are alarmed by the developments. Esther Ansa is a senior nurse officer at the Kumasi South Hospital in charge of the Ashanti Regional COVID-19 Treatment Center, and according to her, Patients are presenting more severe symptoms as compared to the first and second wave. She is therefore calling on all to strictly adhere to the protocols.
COVID-19 is real. It's very real. So everybody should go by the protocols, wear the masks, use hand washing, wash the hands, and use the sanitizer. It is real. And if you see somebody dying from COVID, or a relation or a friend dying from COVID, you appreciate it.
Fortunately for health workers here, no positive cases have been recorded in recent times. The medical director of Kumasi South Hospital, Dr. Kwame Oforibuedu, however, says more deaths have been recorded during the third wave as patients experience severe symptoms.
We think that the Delta wave is more virulent. Virulent in the sense that in the first wave, we could see the time it took for an infected person to progress from, say, mild to moderate or severe. But what we have observed with the third wave, especially the Delta wave, is the progression from mild or moderate to severe or critical is rather very short. And then the death rate is also rather high. And it's not surprising because we all read how virulent the Delta wave is in terms of transmissibility and then mortality. And so we are not surprised with the number of cases that we've seen. We have that proportion of death amongst it.
Dr. Kwame Oforibuedu also disclosed that although the virus has been with us for over a year now, many are still yet to appreciate its existence. According to him, the facility still struggles to convince patients on the need to be admitted after they have tested positive. He is thus appealing to stakeholders to sensitize people on the existence of COVID-19.
Last 3 days, I practically, in the middle of the night, around 9 or 10, I had to come here to convince people to be admitted to the COVID center, this center, because they still denied that their clients had COVID. They think that, oh, well, our client was not well, had fever, but COVID, our client isn't having. But when the test came, and then turns out that it was positive, we had to practically drag the person here. Of course, we do lots of counseling, we do lots of education, we do everything we can within our power to let people know. But why would we wait till the person is sick before we do that? I think that's where you people come in, and then you are doing a lot. I think I said it earlier. I think we still have to talk and then talk to the people on the average person on the street, the average person in church, the average person in our mosque, the average person in the market, to let them appreciate that indeed COVID is here, and then COVID is going to be with us for some time, and so it will be better for us to adhere to the protocols. So sometimes we talk about vaccine. Why are we being vaccinated, and then why are you still asking us to wear our mask? We are not even asking people to wear their mask. We are telling people to wear their mask because the vaccine, like we said, is only one of the interventions to prevent or reduce COVID transmission.
He added that unlike in the first wave of infections where many benevolent individuals supported facilities in treating the virus, the center is now solely dependent on the government. He is thus calling on organizations and benevolent individuals to support the facility.
From the Ashanti Regional Treatment Center here at the Kumasi South Hospital, I am Fati Amin Ibrahim, 4 City News.